Now, World Oral Health Day 2024, and the theme is Be Proud of Your Mouth. Now, on the 20th of March every year, we ask the world to unite to help reduce the burden of oral diseases which affect individuals, health systems, as well as economies everywhere. You might be asking yourself, what is the purpose of World Oral Health Day? Well, World Oral Health Day aims to empower people with the knowledge, tools, and confidence to secure good oral health. Now, why is World Oral Health Day important? Oral diseases are a major health concern for many countries and negatively impact people throughout their lives. Oral diseases lead to pain and discomfort, social isolation, and loss of self-confidence, and they're often linked to other serious health issues, and yet there's no reason to suffer. More oral health conditions are largely preventable and can be treated in their early stages. And that is the reason why we're doing this interview. Now, the person who will sort of guide the ship as we do this discussion is Dr. Que Njotini. And the theme is the healthy mouth is a happy mouth. Now, Dr. Que Njotini, also known as Dr. Que, as I said, which is Dr. Njotini, is a general dentist that is currently doing her community service out in the Cavities area for the Nelson Mandela Bay municipality. Also hails from East London. She's currently a member of the South African Dental Association's Young Dentists Council. She's also recently featured in a career magazine, namely Mzansi Careers with Kanya. Now, Dr. Q's special interests revolve around restoring smiles and oral health, therefore enhancing one's beauty as a whole. Now, she aims to become a health professional that carries the duality of a general dentist and beautician. Dr. Que invests her time serving community at heart since she's originally from the Eastern Cape, and she spends her time aiding the public sector by attending to patients ranging from all ages in different townships throughout the Eastern Cape area. Now, when she's not practicing dentistry, I'm led to believe she's also home watching Pastor Sarah Roberts' sermon or reading up on a psychology-affiliated book. Dr. Que, it is a real privilege and pleasure to talk to you today. Good afternoon. Welcome to Clicks Live. How are you doing?
I am well, Dukes. Thank you so much for having me here. I feel quite honored to be on a platform where I get to do something very passionate, which is oral health awareness.
Fantastic. It is really great having you. And World Oral Health Day, let's just start off there. That is on the 20th of March, which is literally just 2 days away now.
Yes. I'm just so excited because we've got so much lined up. We've got school visits, just everything Oral Health Day orientated. So I'm quite excited, yeah.
Yeah, now this is fantastic. Now, this year's theme for World Oral Health Day is a healthy mouth is a happy mouth.
Yes. And a happy mouth is a happy body, and a happy body is a healthy body.
And that is the important thing. Now, I was mentioning to the listeners as well, you will guide us through this, and I've got a couple of questions. Now, Dr. Que, let me ask you this first up, because this is something that we get taught from as a young child. This gets sort of indoctrinated into you. Why is it important to brush twice a day? Why can't I just get away with once a day?
All right, Duke. So as you know, the oral cavity contains good and bad bacteria, right? We cannot eliminate 100% of the bacteria. So a certain percentage remains in the mouth, right? So what happens is that you consume a meal, right? And it breaks down into small food particles. It then mixes with that bacteria and forms what we know as a layer of plaque. Okay. Right, and as you know, if you haven't brushed for a few hours or about a day, you feel sort of a fuzzy feeling with your tongue. If you go through your tongue and you feel sort of a fuzzy layer on the tooth, this is the layer of plaque. What happens under this layer is that the bacteria consume these food particles and create acid as a byproduct. So this acid now creates an acidic environment in the mouth. This is not the best environment because this means that there's tooth decay. The teeth starts breaking down due to the acid, and what happens is what we call demineralization, right? It also creates inflammation in the gums, and that's why you notice now when you start feeling pain or bleeding with the gums when you're brushing, that is inflammation of the gums, and you get your cavities, and basically that's why when you brush at night, you reduce the amount of bacteria that could actually accumulate or the layer of plaque. So it's definitely important to reduce the amount of bacteria that accumulates, but also toothpaste itself has a very important ingredient, I think most of us know, which is fluoride.
Yes.
This is very important in remineralizing the tooth, which then combats the breakdown that happens when the acid is in your mouth, basically breaking down the teeth. So that is why it's significant, yeah.
Now, when we brush, and I don't know it might sound like a silly question, but I'm going to ask it nevertheless. So it is not just about brushing teeth, but equally tongue as well.
Yes, definitely, because the tongue as well captures the bacteria and captures the food, as we know, but also creates the acidic environment. So it's pretty futile to go and brush your teeth and your gums and not brush your tongue, because it also, plays a part in the oral cavity and plays a part in how much bacteria or how little bacteria you have in the mouth. So definitely, I would say including the tongue is very vital. And if you want to also combat things like mouth odor, you definitely want to scrape your tongue. Yeah.
Because I don't know if this is just a myth, but you some or old wives' tale or anything in that sort of a region. But people will say, you know what, I don't eat sweets regularly or chocolates or any sort of sweet intakes for that matter. But now you do kind of get cavities. Now, why is that the cavities will be there, but you don't really eat the sweets?
Yeah. So I get my adult patients that come in with that sort of issue. So basically, it's not necessarily only sugar that contains the poison, right, to create cavities. Your carbohydrates also break down and cause what we call fermentation. And as they fermentate in the mouth, they also create acids. So anything starchy like your maize meal, your porridge, your bread, that also contributes to plaque buildup, and therefore you can definitely get cavities despite not having sugar in your diet. Yeah. But also what people don't know is frequent snacking also creates a sort of an acidic environment. So like I say, the food breaks down, it mixes with the bacteria, and during that duration, the tooth is sort of trying to defend itself. So it's trying to sort of, combat the acidic environment and sort of increase the pH again with the saliva. But now if you snack again, if you think about it, when you're snacking, there's a shorter time in which now the tooth can actually repair itself. So frequent snacking, your starchy meals, and snacking at night, those are things that can also create cavities, despite not eating sugar. Along with dry mouth as well.
All right. So when you say dry mouth, would a constant consumption of water, would that help?
Definitely. If you're hydrating, but also a dry mouth could be an indicator of a lot of things. It could be that you have a certain medical condition, or you could be a smoker. So if you're also a smoker, you should definitely be hydrating quite a lot, because the mouth becomes dry, and then obviously it's a perfect environment for the bacteria to grow. Yeah.
Given on what you've just said, Doctor, mouthwash, how frequently would you recommend mouthwash then? Because I think of mouthwash and I think it's like sometimes, I like this because it makes life easy.
So, and a lot of people, when you say easy, I think of my patients that actually use mouthwash as an alternative to brushing, right? So it's definitely recommended to use mouthwash when it is indicated, but on a normal basis, I would not recommend your daily mouthwash use, because your mouthwash, as we know, Listerine or any other brand, contains a certain percentage of alcohol, right? So alcohol, as we know, dehydrates anything, right, that consumes it. So if you have alcohol in the mouth, you definitely dehydrate it and create another dry environment for your cavities to form. So I would definitely say twice brushing in the morning and the night, flossing, and then only if you are struggling with maybe, let's say, gum disease, then you would recommend Maridol as a mouthwash, and that doesn't contain as much alcohol as your other popular brands. Yeah.
Okay. Now let me ask you this, because this is like a sort of a question, a real question. Now, if a person is suffering from toothache, but you don't want to get the tooth, let's say, extracted, is a tooth extraction the only option?
No, absolutely not. So As it depends where you go, obviously. So different dentists practice different dental practices. So dental procedures. So basically what happens is that we evaluate the tooth. So you get to your dental visit. We evaluate the extent of the decay, right? And sometimes if the decay is not as much, we go in with a normal filling. If the decay has now progressed to your nerve, let's say it's quite progressive and it's taken a lot of your tooth structure, we would then explore a root canal treatment, and then maybe, depending on how much tooth structure is remaining, we replace it with the crown, right? Alternatively, if we see that, okay, there's too much tooth structure that's been eliminated by the decay, then obviously that's where we would maybe explore a tooth extraction.
Okay.
So, yeah, basically it's our last resort. It's not necessarily the first choice that we go at. Yeah, but also just to highlight that you must come early when you feel a toothache so that it doesn't destroy the tooth so much so that we have to obviously revert to an extraction.
I got you. You got to act early. Now, if you got a filling, let's say a few years ago, but it's now starting to ache again, why would that be?
So with our fillings, in dentistry, we are trying to take away the term permanent. So I think when people get their fillings, they have this sort of impression that now that I've got this filling, I don't have to maintain it. I don't have to, go and look at it again. But what happens is after a few years, the filling itself loses form. It starts cracking. It loses its own pieces that used to be there. And that's usually maybe if you have, maybe you're a grinder. Let's say you grind at night, or you bite on hard foods, and that's just your diet, right? So the fracture, the filling itself can fracture, and what happens is that debris that usually comes under the tooth will go into the filling, under the filling, and cause what we call secondary decay. So we in the first visit, before you had the filling, you had primary decay, and then obviously the dentist removes that decay and placed the filling. But now what happens is a micro leakage of the bacteria causes secondary decay.
Now, I know we touched base about how important the twice a day brushing. You spoke briefly about mouthwash as well. The significance in all of this when it comes to flossing. How important is that?
So flossing is also an integral part of your oral hygiene routine, because if you think about it in this way, I have to put in an analogy. Let's say we're cleaning up a room, right? And we're using our broom to sort of sweep. There are certain areas that need the feather duster to go in and remove the dust, right? Because the brush, the broom that you're sweeping with, is not able to obviously get into the hard to reach areas, right? So like floss is. So floss is the same as the feather duster in that your floss comes in between your teeth where your toothbrush bristles are not able to reach. So you go in the between areas where the toothbrush bristles would normally not be able to reach, and therefore you remove the cavities that form in between the teeth. So that is the significance of flossing every day, is that you are able to reach the areas that the toothbrush is normally not able to.
Okay, so it is a super important.
Yes, definitely.
If you've just joined us in store, thank you very much for being at Click, South Africa's leading pharmacy and health retailer. We're talking to Dr. Que Njotini, a general dentist. I was based out in the Eastern Cape. And the reason we're talking to the good doctor is because on the 20th of March, it is World Oral Health Day. Now, Dr. Que, I want to ask you this. And this is something that that commonly people will discuss, or, it has happened to me. We would have seen this, like when you brush your teeth, there seems to be a little drop of blood. And let's say the gums are bleeding. What could be the problem? What is wrong?
So, just repeat that question for me, sorry.
Let's say when you're brushing your teeth, your gums are bleeding. Or there's blood when you sort of, when you spit out the toothpaste as you were brushing. What could be the problem of bleeding? Yeah.
All right. So for that's a very open-ended question, because there could be a lot of factors, that could influence bleeding in the gums, but primarily it's this indicator of inflammation. So you have 5 signs of inflammation. You have bleeding, you have pus, you have swelling, you have tenderness, and you have pain, right? So when you're starting to feel tenderness and you're bleeding and you are feeling like your gums are swelling a bit, that's an indicator of inflammation. What the cause could be, that could be maybe an underlying medical condition, or it could be like what I said in the beginning, which is not brushing at night, obviously. So not brushing twice a day, you leave your environment acidic, and therefore your gums become more inflamed. So yeah, so those are the most common points, is that it's either due to you not brushing twice a day, an underlying medical condition, or your smoking habits as well could also influence the dry mouth, and obviously dry mouth will also cause inflammation of the gums as well.
Yeah, so several reasons there. Now,
Reasons there.
Now, let's say if a person has a severe pain and swelling, let's say at the back end, like the last tooth, right at the back, what can you do to resolve that?
So at the back usually is your wisdom teeth, and it's what we call the eighth. And what with the eighth is that if they are impacted, and that means that they don't have enough space to come out, what happens usually is that a portion of it will come out, right? And sometimes what happens is at the top, your other wisdom tooth will come out fully for some reason. Sometimes it's genetic. We don't really know. Sometimes it could be that you prematurely had your front teeth come out, so then there was space enough for the top wisdom tooth to come out, right?
Yeah.
So for that, then the top wisdom tooth is fully out. The bottom is not. So what happens is that a portion of the bottom tooth has a bit of the gum covering it, right? So imagine now you are normally biting, and what happens is that the top tooth now bites on a bit of the portion that is covered by the gum, right? And what happens is that now trauma happens to that gum, and then it becomes further inflamed. And also what can happen is that gum covering that portion of the tooth could create a sort of pocket for food to come in, especially if you're not flossing, then more sort of plaque builds up in under the gum. And what happens is that now an infection basically is formed, and it's what we call pericoronitis. So basically for that, you would definitely have to consult your dentist, who would then obviously further assess it and see if there's any need maybe to surgically remove that wisdom tooth, or just treat the pericoronitis and monitor for further eruption of that wisdom tooth.
Yeah. Let me ask you this, Doc. Why do dentists sometimes prohibit patients from taking something like, let's say, grandpa for toothache before and after tooth extraction?
Right. So we like to prohibit them because grandpa, along with Disprin, actually, is a antiplatelet agent. This means that it encourages anti-clotting, right? So what happens when you take out a tooth, bleeding occurs, as we know, right? And what follows is clotting, right? Which is something that we actually need in order for a wound to stop bleeding, number one, but number two, to further on with healing. So what happens is that if in the incident that you take grandpa, right, you are risking bleeding out. And it might not be on the chair. It might be later on now when you're sitting at home and you start noticing that you haven't stopped bleeding. And that's because the blood clot that was supposed to form on top of that wound has not formed, because you have an antiplatelet running through your blood currently. So it's going to stop a blood clot from forming. So this is why we prohibit them, is that it creates problems post and after, pre and post the extraction.
Ah, okay. All right. Now that makes sense. I've been wondering. Now, let me ask you this, because the doctor also mentioned that I may have to get a root canal treatment done on a molar. Now, what does this procedure consist of, and why is it mandatory that I get it?
Right. So, I mean, this is obviously reverting to our other question, which is, extraction is not your only treatment option. I think this is what we are here for, and this is what these radio interviews are here for us to create awareness. There are other treatment options available to save the tooth, and root canal treatment is one of them. So basically with the root canal treatment is we go in, as if we're going in like a normal filling, is we go in and drill, and we drill through the crown, and then what happens is that we proceed into the root canal. And this is where we now remove the infected pulp being the nerve of the tooth, and the debris that's obviously spread down those canals. And then obviously we remove it. It usually consists of a two visit session. So the first session, the dentist probably cleans out the canals, puts an irrigant, and then obviously places a temp restoration. In the second session, this is where they would now shape the canals and then obviously obturate, which is basically to put in a sealant material in those canals to basically seal off any further bacteria from going in and creating any more infection, and then obviously going in with the normal filling. So that is your root canal treatment in 5 seconds.
Thank you for making it 5 seconds. And Doctor, I really would like to thank you for your time as well, Dr. Njotini, for joining us. But before we wrap it up, World Oral Health Day, 20th of March. Any closing thoughts from you, Doctor?
I would definitely say I'm hoping people are more aware. I've been doing this campaign for about 2 years now, and I'm hoping that I'm creating the impact that I want to create, that people are more aware about visiting their dentist. You need to see your dentist at least once a year, because you don't know what problems are currently existing and are becoming worse by the second. You must come in for your cleaning, and I hope everyone has a good World Oral Health Day. Thanks so much, Jukes.
Thank you very much, Dr. Q, for joining us today, and we wish you all the best, and long may you continue with your amazing work. Thank you so much again for your time here with us today on Clicks Live.
All right.
Thank you.
Bye.
That is Dr. Que Njotini, of course, also known as Dr. Q. Yes, and on the 20th of March, it is World Oral Health Day. And just remember that World Oral Health Day aims to empower people with the knowledge, as we just did, and the tools as well as the confidence to secure good oral health as well. Now, this oral health interview is proudly brought to you by SADA, the South African Dental Association. SADA's vision is to be recognized as the trusted leader and voice of oral health care in Southern Africa. Their mission is to promote the interest and serve the needs of our members, and above all, encourage optimal oral health care for all South Africans. Learn more about the South African Dental Association by visiting www.sada.co.za. Also be sure to check out more about the Young Dentists Council, and all the speakers during this week's oral health awareness interviews are part of the Young Dentists Council Exco. So learn more about the Young Dentists Council by simply visiting sada.co.za/Young Dentists Council YDC. Once again, thank you very much to Dr. Q for joining us here on Clicks Live.